Hello, friends. Let us see the next question in our series MCQ for you. I'm Dr. Amit Desai. I'm a surgeon and I teach anatomy and surgery for FMGE and for NEET PG. So let us look at this next question. The most common organ involved in retroperitoneal fibrosis is it aorta? Is it ureter? Is it inferior vena cava? Or is it the sympathetic nerve plexus? So, what is the answer? Yes. Our answer is ureter. Okay, ureter is the commonest organ. Now, let us see something about retroperitoneal fibrosis. Okay, let's see something about retroperitoneal fibrosis, also called as Ormond's disease. Okay, Ormond's disease, idiopathic retroperitoneal fibrosis. So what happens is that there is a proliferation of fibrous tissue. All right, and where is this happening? In the retroperitoneum. It is happening in the retroperitoneum. All right, and it occurs, from where, if you see, these are the renal arteries. All right. And this is the bifurcation of the aorta into the iliac arteries. Okay. And this is the sacral artery. So you will see that this retroperitoneal fibrosis occurs in this particular area. All right. So right from the bifurcation of aorta upwards up till the renal artery. Now this is where it happens. And it encases not only the aorta, it will also encase the inferior vena cava and encase the ureter. Out of the three, the most commonly involved is the ureter. And in the ureter also, it is the lower one-third of the ureter which is more commonly involved. Okay, most common involvement is the lower third of the ureter. Now, are males more involved or females more affected? So males are more affected than females. Usually, if you see the age group, it will be somewhere between 40 to 60 years of age group. All right. And now what is going to happen is that because the ureter is involved, there will be obstructive uropathy. So there will be hydronephrosis and hydroureter. So there will definitely be dysuria. There might be increased urinary frequency. And there might also be fever. Why? Because stasis, as we know, gives rise to infection. So the hydronephrosis is there and there might be superadded infection on that. All right. Many a times people will present with abdominal pain or flank pain. Right. So this is how we have seen how the retroperitoneal fibrosis, idiopathic retroperitoneal fibrosis is affecting the various organs in the retroperitoneum, and out of them also the commonest is the ureter, and out of the ureter also it's the lower third of the ureter which is involved. So in case you get such a question in your examination, your answer will be ureter. All right. Now, if you like this video, then please subscribe to our channel ADSL Academics. Please press the like button and also please press the bell icon. Thank you very much.